Hi, everybody. Welcome to our ImageTrend Tour. You may be asking, why are we doing a tour of ImageTrend via video? Well, if you remember, we had initially planned on launching ImageTrend Elite on April 1st of 2020. Unfortunately, due to COVID, we had to push that date back. We really wanted to find a way to make this training efficient and easy on you. And as it turns out, ImageTrend is a really high quality product. It's easy to use. And we figured a tour with some hands-on practice will help you be familiar and ready to chart in September. So who's switching to ImageTrend Elite? Ambulance operations in Espanola, Lincoln County, and Albuquerque are all going to be making the switch, in addition to our billing department. You may be asking, why are we switching to ImageTrend? Well, there are actually a number of reasons. ImageTrend gives us a couple of things that are important, including mandatory reporting through automated process. It can give us the ability to do one single AR number for multiple patients. It will remove the need to have paper charts. What we'll see is an additional product called Hospital Hub, which allows you to upload your chart. Hospitals can then download the chart in either a draft form or a complete form. This means that we will not be doing redundant charting. This will give us the ability to move and share charts between units, including moving charts from an ILS unit to an ALS unit. And we're hoping that eventually we can move charts between fire departments and our own services. This program gives us some things like a repeat patient data option. So if you have seen the patient before, or if anybody in the system has seen the patient before, you can simply import a lot of that information. It also gives us some things like wireless LifePack upload to the charts. This will make the upload of your EKGs and your end title strips much, much easier and more efficient. There are two different ways that we're going to access ImageTrend. The first is the Elite Web, which is an orange border on the sign-on screen. We're not going to touch that much today. Today, we're going to be really functioning in the Elite field. This is a blue border sign-on screen, and this is where we'll actually spend most of our time. These two programs allow us to move charts between a web and a local computer so that you can chart on multiple devices if you need to. We can also move charts back and forth as you need to so that you can choose where you chart. A couple things to remember as you're logging into this program. When you access ImageTrend, it's recommended that you use the Google Chrome browser. If you try using Internet Explorer or another browser, you just simply won't have the same results. With that being said, you will need internet access for a number of the features, although you will not need it to be able to work on a chart in the field should you have a failure. Internet access is required when you're syncing. This is always going to be at the beginning of the shift, and then throughout the shift if you need to do a sync to your charts. It's going to be required when you're posting. That's how we're going to complete a chart and get them sent off to Hospital Hub. It's going to be required if you're transferring a call, if you're trying to download information from the CAD, if you're trying to generate a PDF, or if you're trying to access the inbox, which is a way of doing secure mail. At this point, you should have already received an email with a link to the login for ImageTrend Elite field. What I'm going to ask everybody to do, first thing, because it's of high importance, is to follow that link and make sure that you can log in. When you go to do the login, you'll have a screen that will look like this. Again, we're going to see the blue border for the Elite field. You will log in using your Presbyterian defined login. This will be generally the first letter of your first name, your last name, and possibly a number. And you will not use the @phs.org. You'll be using the password that is assigned to you. To start, if you have not logged in previously, you'll have one of two passwords. It will either be an exclamation mark, the word welcome with a capital W and the number 1, or an exclamation mark, the word welcome with a number 2. Right now, I'd ask that you pause this video, jump onto Google Chrome, follow the link that was provided, and make sure that you can log in. If you are unable to log in, please email Ken Holcomb and Julia Hines as soon as possible so that they can get you access. If you're able to log in, you should move to a form that looks like this. This is called our Run Form dashboard, and this is where you'll set up some things like your crew, you'll set up your unit, and you'll also set up the medical device that you're using. We'll do a quick tour of this screen. In the upper left-hand corner, you have a field, which is a Find Incident. It's a simple search tool that you may find useful. Directly below that in blue, it shows that I have one incident currently open. This is a chart that I already started and just haven't posted yet. Below that, we see widgets that allow us to assign our crew. You can see that I'm already assigned here. If you have a crew that's already assigned when you log in, you will need to remove that crew. I'm simply going to click on remove and remove the provider. To add a crew, you simply select add. You assign your crew member by doing a search for their last name. It should automatically populate the level of that person, and it's going to ask us to assign what the role is. I'm going to assign myself as a primary caregiver at scene and also during transport. At this point, I can say OK. I'm going to add my secondary crew member, and I'm going to add Julia Hines. We're going to assign Julia as a paramedic. We're going to assign her the roles of primary caregiver at scene and transport. The next thing that we're going to want to double check is our unit. I've already pre-assigned this, but I could use the pull-down menu and pick my unit number, use the pull-down menu and assign my call sign. I can assign the primary role of this unit, as well as the level of care. Below that, as we work our way down around the screen, we do have a place for an inbox. This is a place where you can click and have secure messaging. This will generally be pertaining to something in ImageTrend and will not replace our general email. The button next to that is for settings. If I click on settings, it gives me a number of choices. The ones that will be specifically pertinent are going to be syncing changed resources, syncing all resources, sync all repeat patients. If we want to sync changed resources, this will only be things that were updated in the day since you started your shift. Below that will be all resources. This again will sync everything and just do an update on your system. Next to that, we will have a logout button. That simply logs you out of the program. What this is showing in the middle is our incidents that are currently open. As you can see in the blue field, I have one incident that's open, and this is what it is. Over on the right-hand side, we're going to look at our views. This allows you to customize the view based on the incidents that you have open for whatever is most convenient for you. What we're going to do now is click on the new incident, and this will take us to the incident form page. It's going to ask us for confirmation, make sure that we have the correct crew, make sure that we have the right unit, the right role of the unit, and so on. And I'm of course going to say, yes, that's correct. All right, what we're seeing now is our incident field. This is a new incident, and it doesn't yet have any CAD information in it. We're going to do a quick tour of this, looking at what is called the left side, oddly enough, are the sections, panels, and fields. And then we're going to move on to the right side, and we're going to look at the additional tools that hopefully will help you do charts quickly and easily. We're going to start with the button that says Quick Report. A quick report is going to be a way to get information quickly from a fire department unit, other first responders, or if you are the first on scene, you can fill this out. This will give you some simple questions to ask. Number of patients that are there, recent exposure to infectious disease, time at patient side, first name, last name, gender, race, date of birth, age, along with patient complaints, current medications, and allergies. These are really the fundamental tools that you'll want to do at an initial assessment. While we're here, I'd like to outline a couple different ways that you can pull information in ImageTrend Elite. The first is by simply typing it in and being able to pull an item. For example, if I type in acetaminophen, it will just pull it up. I can select that, and it propagates it into the field below. Our other option is I can use the hamburger button. If I click here, it will pull up a list on the left side of the screen, which is in alphabetical order. I can once again search on this side, typing in, and it'll provide me a list of things in alphabetical order that fit that description. Lastly, we have a stop sign button, which will give me a null field. This will give me the choice to do other, none reported, refused, or any other appropriate, not applicable choice based on the selection that you're working on. This will also give us medications, allergies, environmental allergies, and so on. As you notice, the incident, patient, and disposition field here has a red exclamation mark next to it. What that tells us is this is a required field. If I want to be able to complete the chart, I will need to select something, select my option, and you can see the red highlight goes away. What we're going to encourage you to do is to not chase the red fields, but simply go through in a logical order and make sure that you're getting your chart complete. So the next field that we're going to look at, the next section that we're going to look at is the CAD info dispatch. A lot of these fields will already be populated when you download your CAD data, but know that these are here. We'll encourage you as you're practicing charts to go through each section, panel, and field on this side just to get used to finding things if this is the route that you choose to go for putting in information. Below that, we will find our patient information. The thing that's really important to note on this field is there's a button on the top that says Find Repeat Patient. If you click this button, it will allow you to search for patients that may have been transported recently. You'll need to go in and fill out the appropriate fields. For example, first name is a required field. Remember that it has a null button on the side. If we don't know the first name, we can click here and we can say unable to complete or refused. We'll fill out all of these fields to the best of our ability. The bottom of this field for patient information, we do have an option that says add patient to incident. This is what we'll be doing for multiple patients. We'll simply click here and it will prompt us and say, do we want to add a patient to this incident? This should be a big time saver, so we're not requesting multiple charts and working under different AR numbers. Our next section is on scene. This is going to be your on-scene information. This obviously is symptoms onset. When did we arrive at the patient? Is there an injury? And is this a cardiac arrest? Below that will be questions on patient history. This includes our patient medications, if they haven't already been filled out in your quick form. This will include allergies, again, if they have not been filled out in your quick form. Below that is activities. Activities is a place where you'll put in things like vital sign sets, assessments, your airway confirmations, if you activate a sepsis alert, a stroke team activation, a STEMI activation, if you contact a physician for medical orders, or if you do a CPOT score. This is something you'll be accessing frequently, although there are some other ways that we'll show you down the road where you can work on this. After that, we'll go to a patient assessment. Patient assessment is exactly what you would expect. Our patient complaints, any barriers to care. We'll certainly want to know an organ system and a chief complaint anatomic location. This is where your information for injuries will be entered, as well as any accident information. Following the patient assessment, our next section is going to be the narrative. Remember, and you may have already done the training for this, that we are moving to a de-rescue format. It's a slight change to our prior rescue format, but it's nicely outlined here. There's also a separate training on that, and we'll be going live with that on September 1st. After our narrative, we'll be looking at the outcome. The outcome includes transport and destination information. Once this is complete, we will move to signatures. Each chart will require 4 signatures. The 4 signatures that it will require are going to be an author or whoever's providing the patient care. This is not preloaded and stored for each call like it was in our old program. This is something where you will have to sign each chart each time. You will also have to have your partner sign each chart each time. You'll be required to obtain a patient or patient representative signature, as well as a receiving facility information. Just a reminder, the red colors are fields that are required to be filled in. Don't chase the red color. Work the form from top to bottom. The score for validation, which is currently the -13, will take care of itself as long as you fill everything in. The validation score should be as close to 100 as possible, if not 100, in order to get a chart posted as being complete. When we look at the validation score, because we have so much red, this is showing a -13. If I want to know what I've missed, I can simply click on the validation score, and it will show me the things that need to be corrected. On the top, it's saying that we are an absolute stop with this sign here, right here, that says I need a complaint reported by dispatch. I need a crew member completing this report. If I click on the arrow off to the side, it will take me to the field where those are required. Again, don't chase the red color, don't chase the validation scores. Run your form from top to bottom, filling in every field that you can, and that should be a strong validation score. As we go along the top, we're going to look at all the buttons up here. The first one is a save. This is, it does have an auto save feature when you move from screen to screen, but you can also manually save if you want to. The post button. When clicking this button, you are saving to the cloud. Get in the habit of clicking save and then click post. If you have completed the documentation and have no closed call rules, so those are the things with the small circle with the red slash through it, you can mark the call as finished and it's no longer accessible. If you are not finished documenting, don't check the finished box. Remember, once you finish the chart, it is no longer accessible to you, and the only way that you can make changes is through an addendum. You're going to have two ways to post your charts. From the dashboard, you can select incident and post by highlighting it and then click post. A message will appear asking if you're completely done with the incident. If you check the box that says mark is complete, then click OK. Your incident will no longer be accessible. You can also go to the incident, do a manual save, and click post. The same message will appear. Next to that, we see a print button. This shows you a summary of your PCR and does not require an internet. To the right of that, we see a PDF. This makes a PDF of your incident so far and does require an internet connection. One of the more commonly used buttons will be the CAD button. This is going to be part of your workflow. Your calls that are dispatched have entered are found here. Once you click on the CAD, you'll find your call and you'll hit an arrow to the right of the call. This downloads the relevant data for your call. This includes times, AR number, and call type. Remember that when we started our incident on this form, it does not have any CAD data and it is not automatically populated. What I'll need to do is select CAD. It will search for calls that are assigned to my unit. I will need to select the call that I'm on, and these are all basic test calls here. I will download it into my chart, and it will populate the things that the CAD has provided for me. The EKG button. There are no more cables. You'll find your LifePak 15 because you selected it as your medical device in the beginning and can pull down the records directly from that LifePak 15. You'll click it, you will go to Physio Control Cloud, you will click here, and it will give you all of the different things that have been downloaded from those devices, from your particular device. Select what you want from the LifePak 15 and click download like we just did. You'll go to the far right to open the incident and you'll see a timeline of everything that was downloaded regarding that call. The next button is transfers. As we mentioned at some point, we'll be able to move charts back and forth between fire department units and Albuquerque ambulance or other units. Only certain data points will be downloaded. What you'll want to do is click transfer, and it will want to ask you if you are doing an upload or a download. If we upload our transfer, it's going to say, who are we transferring it to? And we would like to remove the incident from the elite field after transferring. The answer should be no, keep and transfer. You have to finish documenting as part of your chart. You will then save and post, marking it as finished. We can use this button for handoffs between ILS and ALS, but both crews will need to complete their portion of the chart. Next to that, we have a button that says close, and this takes us back to our dashboard. When we look at the right side buttons are really things that can make you efficient and really help to show you what your chart looks like. On the top, we see times. These are going to be very similar to what we're used to. We have the time that dispatch was contacted and notified and when people were dispatched. This will be your arrive at destination scene, which should automatically populate, but we will need to import CAD data. Unit back in service, again, will need to be imported from CAD data. Below that is mileage, very straightforward, and a timeline. The timeline will give you all of the events that happen with that patient. We look at situations. There are two that are currently built and would expect more to follow. This gives us a quick tool of things that we would need, for example, cardiac arrest. This is a place where you can go in and select CPR that was done manually. I can select if the patient was defibrillated, and it's essentially a timestamp. So we can go back and fill those things in later as we have more time. We can continue on through the flow. There was an airway done, there was an OPA. We can say if there was an IV done. But again, we're not adding detail at this point. This is a quick checklist to get all of the things in so that we can complete our chart later. Past situations is the jot pad. Jot pad is a really simple notes tool where on your touchscreen computers, you can make notes that you need to put down. This will not be included as part of the chart, so you can write what you need to, but it will not be included. Below that are worksheets. Currently, our worksheets are for the Connections program at Albuquerque Ambulance. When we go to our worksheets, we will select our Connections tool, and this is how you refer patients to the Connections program. Again, fill in the information, and it will automatically send. When I go back, I'm going to look at our power tools. Power tools are quick ways to enter some patient information. If we start from the top, we'll look at a patient assessment. If we want to do a complete patient assessment, we'll simply click Assessment, and it will give us this menu. We have a couple choices. We can do make everything normal, and you'll see that all of a sudden everything turns blue. Well, let's say that everything isn't normal. Let's say that mental status is not. So we're going to click on mental status, and we can make changes. We can say that our patient is unresponsive. We can say that they're uncooperative. We can say that they're confused. If we want to do a not present or a pertinent negative, we can go down to this button, which says NP tag mode. That is the not present tag mode. We'll select here, and I'm going to say that as a pertinent negative, my patient is not alert, not awake, and let's say not oriented to person. We can see that these fill in black. If we made a mistake and we don't like one of the things that we just put in, we can certainly click on the minus and change that, and we can go back to our other mode. We can select that this is normal baseline for patient. There are lots and lots of options to be able to do these assessments. Really encourage you as you're doing practice charts to go in and dig deep on these. Our next power tool is going to be for vitals. This is a quick and easy way to put vitals in if you choose not to use the left side. This is probably going to be much faster for you, and I would guess this is what most folks are going to use. It's going to be simple questions. Were vitals obtained prior to arrival? Yes. AVPU, while they were alert. We enter a blood pressure. It will automatically populate a map and all the rest of the vitals that you'll find. Really easy to do this, guys, through these pick lists and through these power tools. As we continue on down the list, advanced airways, IVs, medications, we'll take a quick look at that. These are some of our frequently administered medications. Let's say we have one that isn't on there. For example, let's say ketamine. We simply type in the first few letters. It populates ketamine on this side. I can select that and then start doing the information below that I need to do. Procedures. The procedures power tool is really going to be what we're used to in interventions. These two things really between the two programs is a matter of nomenclature, but just remember that your interventions are really going to be under procedures. We have a power tool for confirming an airway, for doing a CPOT score, for entering labs, and for doing a ROS score. Just to hit it again, our validation score. This is where you will find your chart validation rules or close call rules. Click on this number and it will give you a list of everything that needs validation. You'll look for a no smoking sign if the validation rule is in red. If you have none, you may save and post the incident. On the bottom, our last button is going to be the menu. In the menu, you can add attachments to the call. But once you have marked the chart as finished, you must use the addendum button in the ImageTrend web to add an addendum. You may not make changes to the chart itself once you have marked the chart is finished. A commander or someone else will have to unlike the chart for you to make corrections. This is the quick overview and the quick tour of this program. As I said, it's really intuitive and really easy to use. We feel like this quick tour will give you kind of an overview, but now what it's going to take is a little bit of practice. The things that we need you to do to move forward are first and foremost, confirm that you have access to the program. The next thing that we'll need is to have each and every charter complete 3 full charts by midnight on August 25th. The time that you spend here will be a benefit to yourself and certainly make your life easier as you learn to chart on September 1st. What I'm asking you to do is to please chart at least 1 cancel, at least 1 refusal, which includes 2 sets of vitals, and 1 transport chart that includes at least 2 sets of vitals and 3 interventions, including at a minimum an IV, oxygen, and 1 medication. The more charts that you can produce, the more comfortable you'll feel when we roll this out on September 1st. It also gives us more capability to improve the program based on what you're seeing. This also additionally will give our Albuquerque ambulance billers or ambulance billers the ability to practice processing these charts. If you have any questions or problems that come up during this process, please send them immediately to Ken Holcomb and Julia Hines, and they'll take them to the development team. So after we roll this out, what's going to happen? Well, for the first week, we're going to have support and have that available for you. For the lead up time, up until September 1st, we're also going to have some live opportunities when you can get help. You can ask questions. Those will be done via Zoom and will be communicated separately in an email. Please look for additional communications via email. And as a last note, there are a couple things that we'd ask you to check out on your own. One is an app that's called CrewCare. It's a mental health app for healthcare providers that's produced by ImageTrend. The other place to look is ImageTrend.com. They have online training with the ImageTrend University. There are updates at least once a month, and they have free webinars on the second Tuesday and Thursday of each month. I know it's a lot of information. I know that this is going to be a bit of a challenge. I hope that the overview of this program will help make you feel comfortable with it. But really what it's going to take now is getting your hands in and really producing some charts. Again, the requirement for us is going to be that each charter complete 3 full charts by midnight on August 25th. This needs to include 1 cancel, a refusal with at least 2 sets of vitals, and a transport chart including 2 sets of vitals, 3 interventions including at least IV, oxygen, and medication, and of course a full assessment. I'll reiterate, the more time you spend with this program now, the more comfortable you will be when we go live on September 1st. It will also give us more opportunity to develop this program to meet your needs and to make sure that it really comes off without a hitch. If you have any questions, please feel free to reach out, and thank you for the time watching this video.